Hello, my name is Noah Smith. This is my presentation number 3. Here are my flashcards. Healthcare. Healthcare is one of the most controversial and hotly debated topics in American politics today. For decades, career politicians have been addressing this issue and proposing potential plans to change up the current healthcare system in the U.S. Some of the most notable changes to the healthcare system in recent years have been Obamacare with his Affordable Care Act in 2010, or Bernie Sanders with one of his largest campaign promises being to implement a universal healthcare system into the United States. These kind of ideas are absolutely feasible. There are currently dozens of countries around the world that offer universal health care to its citizens. And I believe that a cornerstone to any healthy and functional society is offering health care to its citizens, ensuring that all your citizens are protected from disease and death and able to reap the benefits of the modern medical systems that we have developed as a society. Currently in the U.S., there are roughly 30 million Americans who have no health insurance at all. That is roughly 10% of the population. This means that if any one of these people get in an accident, a car wreck, or something happens, that they will be paying for their health bills out of pocket completely, which we all know is something that is just not financially feasible for most people. It's further estimated that 44% of our population struggles to pay for their health care bills each month, indicating a large financial burden on our society. This is a problem that could absolutely be addressed by the substantial budget of our federal government, and something that is proven to be able to be addressed by other first world countries who offer universal health care to its citizens. Currently, countries like Britain, Spain, Denmark, France all offer universal health care to its citizens while still having competitive care and health statistics to the U.S. Currently, the U.S. has some of the worst health statistics in the world for a country with GDP as large as ours. This is something that needs to change, because currently, healthcare is one of the largest financial burdens on our society. It is estimated that 22 million people die every year from preventable diseases. That means that 22 million people chose their personal finances over their health. They decided to just deal with an illness instead of going to seek treatment because of the financial fallout that would ensue from going to see the doctor. And by implementing a universal healthcare system, we could eliminate these unnecessary deaths. 22 million is an absolutely absurd number. That is more than the Holocaust, more than anyone died in the Afghanistan wars. And yet, it's something we allow to just be acceptable every year in our society, because it's under the illusion that this is these people's personal choice to not seek health care. When, as we all know, when it comes down to money, sometimes we don't always have a choice. And also, offering a universal healthcare system has the potential to make a more efficient system take over our current system. By having a universal healthcare system, everything would be under the umbrella of the government, which gives the potential for a lot of streamlining. By having one payer system where all the bills go to one payer, the government, we could eliminate a lot of the hassle and extra jobs required to make our current healthcare system run. And this would also help incentivize economic prosperity by allowing people to not have to spend as many sick days and spend more time in the office. It is estimated that Americans spend roughly 10 days out of the 365-day year sick. This does not have to be the case. If universal health care was the case, we have the potential to catch diseases before they come. And this is one of the best reasons for having health care, is it could offer a shift in the way society treats health care. People who would usually just deal with their diseases would begin to seek treatment early because it's free. In that way, healthcare could shift to a more proactive approach to treating diseases. It'd catch them early with antibiotics or other methods before they become costly and expensive to treat, or impossible to treat in the worst cases. So, how could the U.S. implement this kind of system? Well, it's important to understand the different kinds of healthcare systems that exist. In other countries, like Great Britain, they have what's called socialized healthcare, which basically the government owns all the hospitals, and all the doctors and nurses are government employees. So you go to the hospital with a broken arm or whatever ailment you have, and you basically don't pay anything. The government just pays for it all because it's a government-run offered opportunity for you to use. Currently, the way it works in the US is we have private health insurance that you pay for on a monthly fee. And now you don't have to get private health insurance. You have the option to opt out of health insurance. And for a lot of young people, this seems like an appealing option, because if you are healthy and don't get sick or injured, you might not have to pay anything. But this is a massive gamble that unfortunately millions of Americans take every year because they don't feel financially comfortable paying for health insurance. And on the other end of the American health system is the people who pay each month for health insurance, which is usually paid for by your employer in some capacity. Usually you pay a little bit of your health insurance and your employer covers the rest. However, if you lose your job, you're left without health insurance, versus a universal healthcare system would leave you with insurance. Other countries, like Canada, have different kinds of systems where there is privately owned doctor's office and hospitals, and there's one insurance provider, the government, who gives basically an insurance plan to all its citizens. So for the US to be able to implement this system, they would have to choose what kind of system they want to implement. And they have a lot of great models they could choose from other countries like Germany, Great Britain, or Canada, that have currently working healthcare systems. And if they choose to adopt one of these, they would have to cleverly find funding within the federal government. But this is not a challenge to be taken lightly. And the government is more than capable of finding the resources to offer universal health care to its citizens, which has the potential to save millions of lives every year.